Hello, I'm Dr. J.C. Smith at Smith Spinal Care Center in Warner Robins. And today I'd like to talk to you about this coronavirus pandemic that we're now enduring. As you can see, I'm taking my precaution as well as social distancing. My clinic has been shut down. Not that people were sick, but they didn't want to get sick. They wanted to do the ounces of prevention and try to avoid it with social distancing and washing and masking and all that sort of thing. But they've talked about the fact that most people who are contracting this virus were sick to begin with. First of all, let me take this off for now. I think I made my point. Nonetheless, a lot of people who are contracting it have impaired immune systems. They have comorbidities, they're elderly. In other words, they were sick before they got the virus. And so we all know by now that medical care, while it's important, it's comforting these people, putting them on respirators and ventilators and all that, there's really no medical cure. There's no vaccine, there's no drugs, they're experimenting, hopefully they find one. But this has caused a lot of people to rethink American healthcare because it really hasn't worked. Not only for this coronavirus pandemic, but for most healthcare it hasn't worked. And there's a lot of facts and figures talking about that. Again, as I mentioned, American medicine is not really healthcare, it's sickness care. Former Senator Tom Harkin from Iowa, he was the chairman in charge of the Obamacare Commission back then. And the first thing he said, the very first day, is that let's be clear, America does not have a healthcare industry, we have a sickness care industry. 95% of the money spent in America is on sickness care, not healthcare, wellness care. Now these are issues that have been around forever. The fact is that the reason why Americans don't participate or know much about them is because we now have a medical monopoly. So where is this monopoly's methods gotten us? Well, if you do a little research like I have, you'll find America does not have the best healthcare system in the world, like we're told by them. In fact, the Commonwealth Fund did this study a few years ago, and they polled the 11 most industrious modern countries in the Western world. And guess where America ranked? 11th. 11th. You know who was number one? Was New Zealand and United Kingdom. They had the best results for the least amount of cost. So when you hear doctors or bureaucrats telling you, be assured we have the best healthcare system in the world, it's not true. Now we do have great emergency care, great surgeons, great hospitals. Unfortunately, they've gone wild. 50% of all heart, back, hip, and knee surgeries are unnecessary according to their own people. And certainly we know that in back pain care. All these surgeons, 90% of back surgeries are now deemed unnecessary by their own people. There are ethical surgeons in the spine world who are saying that. Some have called for a moratorium. I spoke about that before. So don't be swayed that the medical world is going to have the answers to your illness. I was taught when I was a child that the key to nutrition, the key to better health was good nutrition and exercise. Then I went to chiropractic college, and they continue with that, is that what we were taught are to be healthy, you had to have healthy habits. Today, that's all forgotten. Now, it's you have to take more drugs, have more surgeries. That's not health care, that's sickness care. If you don't do the ounces of prevention, you're going to have to pay for those pounds of cures. And even then, they're not effective. For example, the British Medical Journal did this study, finding that 2/3 of typical medical treatments, they polled 3,000 medical treatments, and 2/3 of them were ineffective, too dangerous to use, or no good for nothing. 2/3 of the most common 3,000 treatments. Again, this is the British Medical Journal. They also did a study around the same time showing that American medical care is the third leading cause of death in the United States. Another study, and this is well known, is that hospitals are germy and dirty. You know all these superbugs that have come about now, C. diff and strep and all these others, horrible. No medicines will touch them. That's why sending all these sick people to hospitals is double jeopardy. I mean, not only do they have the COVID-19 virus, which there's no cure, now they're exposed to all those other super germs. So American healthcare is in a state of disarray. And a lot of people are starting to see that now, and they're talking about changing it. Unfortunately, the medical world is in control. It's a monopoly. It's like the fourth branch of government. They control all the leading bureaucratic governmental positions. They're all the spokesmen on television. When was the last time you heard a chiropractor talk about the benefits we bring to us, our ailing society? Never, because big pharma and the medical profession controls everything. This is a form of illness that Ivan Illich spoke about, wrote about years ago. He said there's three forms of iatrogenesis, which is physician-induced disease. First is clinical, where the doctor makes a mistake. Bad drug, bad surgery, bad adjustment, whatever. That's clinical iatrogenesis, and that does happen. And that's what this chart talks about for back pain treatments. In other words, here we have 2,500 medical treatments per 1 million will cause serious death or side effects. Surgery, back surgery, low back surgery, over-the-counter pills, and narcotics. Chiropractic is 1 in 6 million. So who's hurting who? Another thing they spoke about is, that Ivan Illich spoke about, was called social iatrogenesis, where it's not the doctor's mistakes, it's generally the systems getting you ill. In other words, many people don't even access to alternative care. They don't have access to even medical care. Insurance companies are in control. Their philosophy is squeeze care to expand profits. So even though your coverage may say you've got this care, in effect, you're not going to get that much. We see it around here all the time. And so social iatrogenesis is a real problem, in that not everyone can access that care. As good or bad as it is, they can't. And the last form of iatrogenesis is cultural, where attitudes are making people sick. And oh my word, do Americans have what now deemed widespread misconceptions about spine care and about health care in general. That's why Americans are so sick. As I say, we lead the world in every category of disease, serious chronic illnesses. And it's not because we're more prone to heart disease or cancers or back attacks, heart attacks, fat attacks. It's because we have bad attitudes. What people are being taught is just not working. And it's about time that this became known. And I just think this is really affecting the brand of the medical world. In other words, for years they were preaching that they were the best, but no, that's not necessarily true. And there's been a lot of evidence that people are not accepting that. For example, this was a recent article in the Pain Journal that I found just today. And they finally are owning up to the fact that primary care for low back pain, we don't know the half of it. Oh, well, chiropractors been saying that they don't for years because they don't study the back pain business in school. And yet they go out and they're the ones who created the opioid epidemic that we now have by throwing pills at everybody instead of sending the chiropractors like they're legally required to do according to the informed consent laws. No, they badmouth us as if we're horrible and dangerous and blah, 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 which is totally the opposite. You do all those unnecessary spinal injections that are very expensive, short-term at best, and basically don't work. As one researcher called it, they're underwhelming. They just don't work, but they're very profitable, and people are still being misguided. They're gullible patients, and they believe these doctors who are untrained, and then of course you have the back surgery business that is totally out of hand. It's the most profitable industry in medical care now, more so than heart care and cancer care is spine care. It's amazing. The average single level spine surgery now, according to the Mayo Clinic, is $77,000 for one disc surgery, when in fact the disc is not even the main cause of the problem. As I've spoken before in other videos, it's joint dysfunction. In other words, you don't slip discs, you slip joints first. Then that causes the bad disc, pinched nerves, blah, 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 the sequence of events that happens. But people are wising up to this because complementary and alternative medicine is growing by leaps and bounds. It may not be covered, you may not hear about it on television, but this is an underground swell that actually now is more popular than medical care. This was determined by Dr. David Eisenberg at Harvard in the late 90s. He did 2 surveys in 90 and then in 97. And this is what he found. It's just shocking, but he found that in 1990, there were about 500,000 visits, 427,000 to primary, to alternative practitioners, as opposed to 387,000 to primary care. In 1997, that had increased. Now there were over 600 million visits to alternative health care, as opposed to just under 400,000 MDs. And of course, when this research came out, the medical world spokesmen all threw up their hands saying, why do people want to go to quacks when they can have wonderful scientific medical care, joint shots and surgeries? They just don't get it. And but the people are getting it. And this is a graph that they also found of the alternative healthcare providers. And the red are chiropractors. You can see who the people are seeking out most of all. The green was massage therapy, and those are the two treatments we offer here, along with the anti-inflammatory diet, which is so terribly important to deflame your tissues chemically. But we have this, we'll post these, but nonetheless, you need to know that, as Dr. Eisenberg said, I went to one of his seminars, at the end of it he said, maybe alternative isn't so alternative anymore. And that's the truth. When more people are going, but again, people aren't hearing about this because we don't have access to the media, which is what my latest book was about, To Kill a Chiropractor, the media war against chiropractic. You just don't hear the good news that we offer the public, although the research is full of it now. And one reason why they don't hear it, and this is what was most interesting, was that the medical war against chiropractors wasn't just against my profession. The AMA has had wars against all alternatives. The first war they fought was against dentists. That shocks most people because now they've got their own monopoly. That's why dental care is 3 times cost what it should, and they all work 4 days a week and drive big black Mercedes-Benz, at least in my town. But what happened, the original dentists were DDS. You've seen that, DDS, Doctors of Dental Surgery. Well, in 1867, Harvard decided if you're going to be a dentist, you had to be a medical doctor first. So they created Doctors of Medical Dentistry, DMDs. And they kind of fought tooth and nail, and finally they buried the hatchet and became under one license, which they are today. And that's why it's so outrageous, their costs and all that. Because a few years ago here in Georgia, Emory University shut down its dental school. Why? Well, it wasn't because there wasn't a need for dentists, but they just wanted to reduce the supply of dentists, which then drove up the demand and the prices. And that's where they are today. So the medical world has a monopoly, and so does the dental world. Another group that the AMA was really hot after was homeopaths. These are the people who use herbal remedies. It's like natural vaccines, like cures, like is their motto. And they're very effective. I've used homeopathic vaccines, if you will, or tonics, with my own children. Instead of getting the toxic immunizations that were very dangerous, we use homeopathic vaccines, and my kids have never been sick. It works, but of course, the AMA still fought tooth and nail to get these people de-licensed. And so today, you can't find a licensed practitioner, because most of them were MDs, who are homeopaths. It's a great science. Prince Charles in England, he's a big fan of theirs, and he's testified in their behalf. So after they got rid of the homeopaths, then they turned their guns toward the osteopaths. Now, osteopaths originally were like chiropractors. They manipulated the spine to help people. But instead of talking about the rule of the nerve, as we do in chiropractic, they talk about the rule of the artery. Because from the spine itself, not only the nerves come out, but so do arteries and lymphatic tissues and other things. And A.T. Still, who was the originator of osteopathy, he was an MD by training, so he still had that orientation. But he turned away from the drugs because he had 2 or 3 members of his family die, and there was nothing he could do. So he said there must be a better way. And some of the best research I've seen on spinal care was done by osteopaths. Unfortunately, they sold out. In 1962-63, when JFK was president, he was the man who instituted the legislation for Medicare, Medicaid. And everybody wanted in. It was interesting, was that who took over? The AMA, because again, they're all the medical bureaucrats. And they made a deal with the osteopaths that we'll let you in if you give up manipulation. Isn't that amazing? They gave up their healing art. And again, manipulation is not new. It goes back over 2,000 years to the recorded history in Egypt showed in Hoptep, the physician of the great pharaohs, did manipulation. Every society that's recorded its history, which was Greeks, the Romans, the Chinese, in 1510, European, old medieval Europe, they coined the term bone setters to talk about manipulation. It was those bone setters that immigrated to the United States and created osteopathy and chiropractic. But nonetheless, they sold out. That's why today a DO, an osteopath, is the same as an MD. They're under the same license. They have the same privileges. But most people have no idea what an osteopath does. Well, they used to do manipulation. Some of the equipment I have in my office are old osteopathic tables that work great, but they sold out to become a regular MD. So then they also turned their guns toward optometrists. In the 60s, they were trying to have them eliminated because the ophthalmologists didn't like them competing with them. But there was a optometrist in Chicago in 1966. His name is Cyrus Bass. He filed an antitrust suit against them and won. So that's why today they've laid off. Optometrists still exist very much. And they fought against podiatrists and others. Today their guns are on nurse practitioners. They don't like competing with them because they do the same services at half the price. And they don't want that. They don't want to bring down the prices in medical care at all. Of course, the biggest guns were against chiropractors. And that battle, since the day the first chiropractor opened his office, they were fought tooth and nail. In the first half of the 20th century, over 12,000 chiropractors were arrested over 15,000 times for doing what I do in my office every day. Helping people with no drugs, no surgery, just with our hands, we adjust people's spine and they get better. And of course, AMA didn't like that. So they started spreading their misinformation, their slurs and name calling, and they also fought legislatively against us because chiropractors started getting licensure in every state of the union so they couldn't be accused of practicing medicine without a license. In those days, before that protection, if I just talked to you about health or touched you, that was practicing medicine without a license. That's why a lot of chiropractors went to jail. And a lot of them were helped because by their own patients and even the police, because they wouldn't testify against their chiropractors. It was amazing. In my book, I talk about that. And if you're really keen on the history, this is what you need to read about the whole medical war against chiropractors alone. But that changed after the Welt trial, which in 1976, 4 brave chiropractors and an outstanding attorney, George P. McAndrews, took them to court. And what was the smoking gun was this book called The AMA in the Public Interest by a pseudonym, William Trevor. But what made this so fantastic was this was done by the Church of Scientology. You may remember L. Ron Hubbard. He created that science fiction religion. First it was a science fiction psychology, very metaphysical. He was a science fiction writer. But it had a following, still does today. Scientology, everyone knows about that. But anyway, the AMA busted him. They said, you're practicing medicine without a license. So he got smart. He said, okay. He just made it into a religion, Scientology, Dianetics. And then they couldn't prosecute him. But he was pissed off. So what L. Ron Hubbard did is he formed his own little FBI department within his religion. And they infiltrated the AMA's headquarters in Chicago. It was remarkable that there were 3 saboteurs who worked inside the AMA. AMA didn't know that, but at night, when everyone left, these spies went through the AMA's files, and they came across this war against chiropractors, and what they did is they actually photocopied the actual letters and communication, the whole strategy you can find in this book. And they, when it was done, they self-printed this. They went to the Chiropractic Association. Jerry McAndrews, the brother of George McAndrews, who was then the former president of Palmer College in Davenport, the fountainhead of chiropractic. Then he was the executive vice president of the International Chiropractic Association. And for $15,000, they handed over the copyright of this book. Well, their whole case was made for them. The smoking guns were all there. And so that's when they went to court. And it was quite amazing. I've spoken about this before a little bit, but it actually went from 75, 76 to 87. There were 3 trials, and then it was appealed to the U.S. Supreme Court, who declined to hear it and review it in 91. So that was one of the longest antitrust case in history. But at the end of it, they had numerous medical doctors. There are ethical doctors who know chiropractic works, and they testified on our behalf. But they also put in the AMA's bigwigs, the propagandists themselves, who are spreading all this disinformation, this fake news about chiropractic. For example, they were doing this out of public safety because chiropractic was so harmful. Well, you know, in the whole trial, they did not bring in one injured patient, not one. Yet, even their own people, the Blue Cross Blue Shield people, because they're in cahoots with the AMA, they said, don't bring up the danger thing because we can't prove that. As I showed you before, 2,500 people per 1 million will be hurt by medical spine care, as opposed to 1 in 6 million by chiropractic care. One of the first witnesses they put in the stand was the AMA bigwig, and they said, what do you think of chiropractors? Oh, and here came the misinformation, dangerous, unscientific, quackery, blah, blah, blah. And Mr. McAndrew said, fine. Second question is, prove it. They couldn't prove a damn thing. Nonetheless, the end result is the judge, Susan Getzendanner, and it says all in my book, she actually said that she did not support them. Chiropractors won the case, but she said in her opinion that there was more evidence showing that chiropractors were better trained and had better clinical outcomes than anything the medical world had to offer. Yet what happened? We won this historic antitrust case. A little money was exchanged to pay for attorney bills and money to a child's chiropractic hospital, and the colleges got some money. It was pocket change to the AMA. They felt they had won because no one went to jail, even though what they did was totally illegal, antitrust type of crimes, and they just continued doing what they're doing. For example, after the decision was rendered, a few years later, since I've known George and Jerry McAndrews, I've met them many a time, they're great men, George sent me a stack of transcripts from the actual trial. And that's what most of my book is, actual transcript information and witnesses. And one of the witnesses was an interesting, he was a member of the AMA's Board of Trustees. His name was Erwin Henderson. And when he was in World War II, he was a orthopedist, and they had an interesting case. A captain, Marine captain, who was an all-American football player in college, as tough as they come, right? Well, he was hurt in the Battle of Guadalcanal. He threw out his back. And so they brought him into their MASH unit, and nothing helped. No medical treatments helped. And what the Army did back in those days, if you were a chiropractor, you couldn't practice. But they made you into a tech, a radiologist, or something like that. Well, Dr. Henderson knew there was a chiropractor on staff, so he said, give it a go. And within 1 or 2 days, the captain was totally improved. He went back to the fighting front. And so Dr. Henderson said, there's something to this because it works so damn well. And he wanted the AMA to investigate it in a positive sense. Let's find out what they're doing and incorporate it. Well, the AMA squashed that, but it came out at trial, and a lot of other interesting things came out. These admissions against interest, as they're called legally, where an MD was testifying against the medical world but for chiropractic. And a lot of that information still exists today, but again, you're not hearing it because Sanjay Gupta at CNN will never tell you this, nor will any of the others. With that information in hand, I went to my local hospital because the point that the judge made is what made it illegal was that what's called Principle 3 and Principle 4. Principle 3 in the Medical Code of Ethics said that if you're an MD and you're associating with chiropractors, referring or letting them use your facility or hospital, that you would lose your license or the hospital would lose its accreditation just for allowing a chiropractor to come around and use your facility or to refer patients back and forth, as they were doing before the trial even happened. So that was illegal. And another thing, in a public facility, they cannot keep you out because of your license. That's pure discrimination. Now, in a private hospital, they can let anyone in and they can exclude anyone they want, just like my office. I don't have to let any other physician come in here just because he's a physician or another chiropractor. So anyway, with that in mind, I took all that information to the board. And it was quite a 2-hour meeting, I might add. First of all, the chairman, a local CPA, did not want me there. The whole time I was being interviewed, his face was twitching out of hate. Remember the movie Bueller's Day Off? Remember the assistant principal that was chasing him around Chicago and his face twitched? Well, that's what this man was like. And he'd ask me a question, and only he asked me questions. None of the other board members were allowed to, one of whom was my next door neighbor. Nonetheless, at one point, I was well prepared. I mean, I had the information, the facts at hand, and I knew more about that trial than they did. And at one point, I answered the chairman's question, and then he had the gall to say, "Well, Dr. Smith, you seem to have all the answers, don't you?" I said, "Why are you acting like this? You asked me a question, I give you an answer, and then you're being sarcastic." And then at the very end, the 2-hour inquisition, I might say, the little attorney who was in the room didn't say a word. And then at the very end, after all the questions and answers were done, he blurted out to the panel saying, "Well, you know, if you let a chiropractor on staff, you lose your accreditation." Huh? A shockwave hit the board members because I had them convinced. And I said, "Well, that's not true. That was the whole point of the trial." And he goes, well, I'll get back to you on that." He didn't know what the hell he was talking about. But again, that scared the snot out of these board members. And then it gets worse. They said, "Well, we have a monthly meeting. We'll have you come back the next month and we'll tell you our decision." So I knew that was coming up, but I never heard anything. So I started phoning them, when and where. Got no response from anybody. And then, just to show you how devious they were, I had tickets to the Warner Robins Demons high school football games. And they won 2 national champions, 4 state champions. They're a great team. They've been to the state finals 3 years in a row lately. So I went to the football game. When I got home at 10:30, the reporter from the Macon Telegraph newspaper said, "Why weren't you at the hospital board meeting?" I said, "What? A football Friday night?" He goes, "Yeah, they met not in Warner Robins. They went down to a facility in Perry and had a secret meeting." And the next day in his article in the Macon Telegraph newspaper, it said, again, this little attorney, I say little because he was a little guy, he said, "Let the record show that Dr. Smith didn't have the decency to come to our meeting." Huh? But that's been the attitude that I've met in this town for 40 years now. They don't refer, they don't cooperate, they railroad everybody into back surgeries, which is why Macon ranks 4th on the list nationally in back surgeries per capita, and it's number 1 in the state of Georgia. So that just shows you that even though we won an antitrust case, nothing changed. And I have example after example that I'm going to talk to you next about the state workman's comp, how corrupt it is, as well as TRICARE, the Air Force bases, healthcare, how corrupt it is. Otherwise, I say if you want to learn more about this fascinating study about how the AMA developed this monopoly and how ineffective it's become, get a hold of my books. These are interesting. You can buy them online. They're cheap. Actually, they're cheap at twice the price for the amount of information you're going to get. Otherwise, I want to thank you for listening to my latest rant, and I'll see you at the next one.